you so much. It's wonderful to have a good speaker like Dr. Isha Ahluwalia talk on a very, very important topic, burnout syndrome. I think this is a very topical topic for our country. I mean, considering the fact that the doctors here have to confront a very large population of patients. I mean, there are many amongst us who see something like 60, 70, 100, 120 patients in a single day. So I think a large number of patients to be seen over a few hours with often multitasking at the clinic, jumping from one task to the other and doing this day in and day out for at least 6 days a week. I think that quite understandably is going to cause psychological difficulties. And I mean, one of the fallouts of these is burnout syndrome, on which Dr. Isha would be talking. So I think it's a very important topic for us Indians. And Isha, I can see many very busy practitioners in the audience who must be seeing a very large number of patients per day. So we have a high-risk population of people here. Yeah, would you like to contribute something? Okay. So Isha, you could please go ahead with the talk.
Thank you, sir. Like sir has already explained, why is it important for us to know what burnout is? Right? Because we are dealing with a huge population and we see definitely more number of patients than the Western doctors do. So I'll start like this. Have you ever felt that you are too exhausted to work any further or your batteries have just run down? Have you all? So yes, definitely we all have at some point of time. Let me explain this occupational phenomena by comparing it with a bank account. So imagine we have if we have a bank account which has a good balance in it, it is definitely beneficial for the person who holds it and the bank as well. However, if for any reason the bank account becomes empty or it goes into negative balance, we know that the bank account does not close. It still continues to function. Similarly, something like this is what happens in burnout. We continue to function even though we are exhausted, we continue to see the patients, but the mental and physical vigor is definitely lost. This will in turn lead to some poorer outcomes in terms of delivery of care and patient satisfaction. And it has been recognized in ICD-11 as one of the diagnostic code as well. I would like to take a poll here. What percentage of doctors do you believe feel burned out at workplace? So that's exactly correct, right? In India, we do not have much of literature in it, but there is a physician burnout and depression report of 2023, that is last year, wherein it was found that 1 in 4 doctors were either burnout or depressed. And this is more than what was in the COVID era. So this is really alarming. It was found that almost more than 50% of doctors were burnt out, and out of them 20 to 25% had been depressed. The Indian studies, which how many ever we have, the data is similar. Burnt out is going as high up to 60% as well. The gender differences were also found, wherein women reported more burnout than men, citing multitasking like managing family, childcare taking toll on them, and workplace inequality as their reasons. If you might have seen, I had conducted we had put a Google form in the respective groups, and we got some answers from you all. So this is the projection of the answers that we all got. So we got that nearly 42% in this poll as well said they feel exhausted while they're working. They were unable to re-energize, that was somewhere around 36%. And surprisingly, almost 21% of people said that they had aversion towards their jobs, which is quite a high number. So definitely there is a burnout. So which specialty of medicine do you believe has more chances of burnout? I think the audience here is quite aware and it's correct as well. Most emergency medicine definitely tops the chart. As we know, they are working in very high-stake situations. But what noteworthy here is to know that almost all specialities, the burnout was more than 40%, which definitely puts a very high burden on healthcare system. Now, the factors that can contribute to workplace burnout could be too long working hours, which is very true in Indian setting, lack of control on, and autonomy over your activities, insufficient compensation, lack of respect from co-workers, employers, and patients. The most relevant right now is risk and violent threats and security lapses, and definitely there are inadequate government regulation to safeguard us as well. Now, let us see where it all starts. Let us go back and remember our residency days, where it was some sort of a gladiator-style survival contest, wherein you had to have certain qualities in order to survive that residency, right? So the traits that were desirable were either you should be a workaholic, you should have no other interest whatsoever apart from doing the residency. You should be superhero, getting up at 5 a.m. in the morning, go for rounds, then do OP, wards, push a stretcher if it is required to, and then you should never be looking tired as well, and make no mistake. So you have to be a perfectionist as well. And while doing it all, please don't crib about it. So that was again most important. So you have to be emotion free as well. So all this we have all done it, and we know that the prime directive behind it was that patient comes first. We have to serve the patient come what may. But imagine that one day during your rounds, your unit head, who is really compassionate and has asked you whether you're feeling tired after doing, say, a 24-hour or a 36-hour shift, what would be your answer? How many of you will say, yes, I'm tired? So yeah, so we are hardwired to do that. We will never say, because we cannot show weakness, we can still work, right? So we are not going to say we are tired, and that is what made us hardwired for self-denial and burnout. So it all started there. So now let us understand, like we are saying, there's a burnout, but what is it? What do you mean by burnout? So burnout means exhaustion. It can be mental or physical. Mental in the sense that you're not enjoying your work anymore, and physical is you do not have energy to do anything whatsoever. Now what happens after that? When we are too overworked, we are seeing, say, 80 patients a day, 100 patients a day in a government hospital OPD. You cannot examine them properly. It's difficult to take a proper history as well. And in a way, we start to lose empathy towards this patient, and we just treat them as our subjects, as our cases, and we continue to just go beyond that. And that is what a depersonalization here means. And when this continues to happen, we become sort of more negative, and we are too overworked, we are too tired, we cannot think of anything else, and that is definitely going to cause some efficacy loss in what we are doing. And also, we do not get those a feeling of personal accomplishment as well. This then leads to a distance from the mental distance from our jobs. And if this continues for a longer period of time, one is bound to be psychologically distressed. That is one of the common things that we go through is we go through a lot of mood swings. Then there is irritability, anger, some psychosomatic complaints, like most of us generally we put out our pain or the fatigue that we are experiencing in the form of somatic symptoms, like I'm having headache today, there's a backache, or multiple aches and lethargy. And this definitely will again reduce our productivity, and ultimately depression can set in as well. So this is the cycle of burnout, as you can see. Herein I would like to talk about two terms that you can see: moral injury and compassion fatigue. Moral injury is something that can happen when you're working in a high-stakes situation, when you're working in ICUs, emergencies, or something like a scenario like COVID. wherein we did not know how to treat the patients. They were all dying. There was so much workload. The shifts were so longer and we were not able to achieve much out of it. Then that led to moral distress in the form of guilt, shame, and anger, and triggered certain stress reactions in the form of negative attitude towards our own selves, sleep deprivation, and overworking. That is compensatory overworking in order to try to get something out of it. And compassion fatigue is something that when we see a lot more number of patients every day, we are not able to, we are so exhausted that we are not able to see the empathy involved in treating those patients, and that will increase error and decrease quality of care. What is the bigger result of it? What is happening after that? Let us see what's happening. This is all in the news these days. We have seen what's happening in the bigger picture. So we have talked about what happens in a professional burnout setting. Now, do you think that, what do you think, that it affects our personal relationships as well? So this data is higher than what I have. We seem to be too burnout, I think. So this is the Western data which we have. So 65% over there said that yes, it definitely does. We are, and how do we express it? We are always in a bad mood. We become, patients, like people have said, they have become negative people and they do not recognize themselves anymore. And then we know that something is happening personally, something is happening professionally. So now what will you do? Will you ever seek help? You're 90% personally burnt out. So are you going to seek help? So, okay. So, here only 13% people said they'd seek help. 47 outrightly, they said that we'll consider, and 39% said we'll outrightly deny. No, we are not going to seek help. We are continuing to be burnt out or depressed, but we are not going to seek a professional help. So, now that we know that it is definitely somewhere percolating into both our personal and professional lives, then what do we need to do about it? So if you're not going to seek help, but we need to do something about it, I would definitely say you must, but let's see what we can do. So how many of you, just raise your hands and tell me you have work-life balance? Because the answer is work-life balance, but how many of you have? Okay, very few, and that's, now let's see the people who do not have it. I have some tips for you. So definitely what you need to do is plan ahead, because we cannot control our work. We cannot control how many patients are going to show up in our OPDs. So time management is always going to be a thing. So plan ahead, prioritize your responsibility, be it at work, be it at personal life. You need to understand that you have a certain pace, and beyond which it becomes too pushy and it causes exhaustion in your personal capacity. As much as you can, keep electronic records of whichever patients you are seeing. We know there are a lot of medico-legal issues these days. Telemedicine has been a boon, and definitely make to-do list so that in all this exhaustion you are not forgetting something important. Most important for all of us is to set boundaries, both with patient and at workplace. And we need to learn to say no as well when our body is giving up and we are not able to cope. Take time off, recoup and re-energize, and definitely seek mentorship. Stay connected with colleagues and seniors. Their experience might ease out your professional hiccups and will also improve your knowledge and healthy working relationships. Belongingness goes a very long way. Stay connected, indulge in group activities at work, celebrate festivals, group lunches, tea breaks, share experiences while at work, create a cohesive atmosphere at your workplace, be very inclusive and communicate. It will reduce half of the hostility and improve your working relationships. We definitely do this at Midas. We try to have tea breaks and lunches together. So it's definitely ease out your brain. Attend CMEs, conferences, workshop. You get a time out, you get to meet people, and it's relaxing. If you're working in a personal setting wherein you do not have a group, try to start your day early if you can. That way you get some time for yourself so that you can do perform your interests, whatever interests you. Get enough sleep, maintain a healthy diet, exercise regularly, have a good support system, and take time out for yourself. Practice mindfulness. It is a form of mental training to stay in the moment. Practicing mindfulness helps us acknowledge our thoughts and emotions as passing events, something that we will overcome with time. I would like to quote here once what I had heard in Bhave sir's lecture, wherein sir said, if there's a problem and if it's not going to last after 10 years, maybe it's not worth of your time. You are definitely going to overcome it. Don't stress too much upon it. And it's something that's there right now, but will not be there tomorrow mostly. This will give you a greater sense of autonomy, patience, and you'll be less susceptible to emotional distress. Organizational strategies, repeated debriefing sessions, teamwork, work schedule rotation, stress management training, self-care workshops, communication skill training, and always remember that your own resilience, your own coping is going to play a huge role in how much burnout you might feel or not. And the most important and definitive thing that one needs to do is we have to make a better work environment for our residents. Provision of basic needs, including safety at workplace, specified working hours, adequate life and adequate breaks and dignified lives. Law and enforcement regulations need to be very strong in order to safeguard doctors from violence and threats. And if you can Google it as well, there is a program held in KEM wherein they provide support to their residents in terms of distress. And at the end, I would like to say, burnout is a global crisis. We have seen it here while we have taken poll. There is data saying it everywhere. It's very real. It's a real problem. So try to keep a positive attitude as much as you can. Work harder, but please work smarter as well. Find time for yourself, safeguard your physical and mental health, and seek professional help when needed. It's not going to be a long-term thing, but it will help you really. Thank you. So this is an app for mindfulness. If anyone of you wants to download it in your free time, maybe it will help you learn what mindfulness is. Thank you.
Thank you, Dr. Isha. It is such an important topic, but it's a wonderful take. You have encouraged people gathered here to do something which is difficult, introspection. Maybe people will acknowledge which is something which is there. And it is really difficult to set that boundary, the effort which has started with a dedicated effort and turning into exhaustion. It is very difficult to mark that boundary line up to what level it is good and it is not. So I think it should have evoked so many questions, but due to the scarcity of time, we'll invite just a couple of questions. If there are any questions.
Hello, we are all ambitious people sitting here or here. I see Senior Dr. Srikant Mukhewar and you quoted residents, which was a coming thought in my mind. I don't find them burnout. The doctors who had been working for more than 40 years, and we find residents and new doctors, they get burnout easily. Should we find out the balance? Or what is the छुपी बात क्या है जो डॉक्टर मुखेवार इतना भी काम करके वो बराबर अपना एम्बिशंस मेंटेन कर रहे हैं? एंड ही सेड दैट आई मैनेज माय टाइम. ही रेज्ड हिज हैंड. आई वाज सरप्राइज्ड टू सी हिज हैंड रेज्ड. Yes, few people do it. My question is, there is something like quiet ambitions. Is the living more important than fulfilling the ambitions? How can we find out the balance? Because we all are thinking in terms of achieving our ambitions. Can we keep our ambitions less and focus more on living?
Sir, I think we should never be content while we are being ambitious. There's always a chance for something more that you can do. But at the same time, you have to understand, that's one thing like Sir said, we never introspect what we are feeling while doing all of it. So we should be able to acknowledge that as well. And I don't say that don't go forward when you're not able, if you're burnt out. Maybe resolve the burnout issue and then go forward and do what you want to do.
Can I just I'll add a comment to this burnout stress, what you're talking. There was a journal which was discussing about what's happening in the post-COVID era. And this post-COVID era has given birth to two illnesses. One is boss, another is Ross. Some people are doing whatever work they were doing, they are subjected to 3 times more work. So they're getting burnout. And they are getting burnout stress syndrome, that is boss. But more number of people, they have lost their job. And now they are doing a job or a work or whatever, 1/10 of their capacity. And they are having more stress and they are called as Ross. And Ross is like anything which is less than your capacity and you are asked to do it and you are still doing it. And Ross stands for rust out stress syndrome. And rust out stress syndrome has more chances of going into depression and psychiatric illnesses.
Sir, yes, obviously, it's like somewhere near, if you're not getting enough work, definitely it will have its own consequences. I'm not sure how relevant it is in our practice with regards to doctors.
Yeah, all doctors are boss only. They cannot be Ross.
Exactly. So that is something, it's a different kind, definitely it is somewhere near if you compare it with something like unemployment. It's not exactly unemployment, but you're getting less work than you can do. So that itself can be a trigger for mental health issues as well. Yes.
You have to answer Dr. Duffley's question, which is very important. Young people versus...
Okay.
And then the second part also, why Dr. Mukhewar is not burnt out.
So Sir fulfills all the requirements for organizational good care and personal good care. That's why he's not burnt out.
I think it would be wise not to follow Dr. Mukhewar because he is statistically abnormal. I mean, he is at least 3-4 standard deviations away from normal when it comes to, ability to maintain a fantastic work-life balance. So I think we can only admire him, not emulate him.
Thank you for a wonderful lecture.
Indeed, burnout needs to be discussed and spoken about loud in our doctor fraternity. Thank you to the chairpersons. I would request the speaker and the chairpersons to please collect their mementos.